Welcome back to Long COVID Doctor, an educational series for sufferers of long COVID. This is the second part on my talk on fatigue and long COVID. In the first part, I talked about the symptoms, the diagnosis, and investigations. In this part, the second part, I will talk about the treatment, management, and outcomes. References and links and resources are in the show notes below. And the usual disclaimer, any advice, diagnoses, treatments that I mention should only be considered after discussion with your own GP or qualified health professional. And so here we go, part 2 on fatigue and long COVID. The specific management for long COVID fatigue. Basically, treatment of any conditions through the history examination that I described at the beginning, with the blood tests, etc. Obviously you will have dealt with, or that will have been dealt with by your health professional. If that might have led to referral to specialists in the hospital service, wherever appropriate. Then the history and examination may well have led to specific symptoms that also needed to be dealt with. So associated long COVID symptoms that need to be dealt with, such as, say, headache, a worsening of headaches, or new headaches, or worsening of previous migraines, for example. So patients will have been advised to, say, for example, trial of amitriptyline. Joint pains, joint aches will need anti-inflammatories. Chest pain, having excluded other sinister causes of chest pain, the patient may well be diagnosed with the COVID grip. So, they'll need treatment with such as anti-inflammatories or colchicine. History examination may have led to diagnosis of dysautonomia or POTS. So that patient will have hopefully been trialled on beta blockers or maybe referred to a cardiologist. The patient may have symptoms and presenting features suggestive of mast cell activation. And so they will probably be wanting to have antihistamines, H1 blockers, H2 blockers, antihistamines, H1 blockers, or antiacid tablets, H2 blockers recommended. I talk about these in another episode of my series. But yeah, certainly those other long COVID symptoms need to be dealt with, as well as the point of this talk, and that is the long COVID fatigue. So what can we do to help recovery from long COVID fatigue? Essentially, the key to managing fatigue is to bring about energy conservation. And that is to use the 3 Ps. You'll get very used to this. The 3 Ps stand for pace, plan, and prioritize. This is most expertly explained by our occupational therapy colleagues. Certainly I've got lots of OTs in the services that I work in. The first of the 3 Ps, first of all, the first P is pacing. In order to pace, you need to be aware of your energy limits, otherwise known as the energy envelope, the capacity, the energy reservoir, the number of batteries you've got. Basically, have you got the full 4 batteries, or is it only 3? Then energy expenditure is tailored to the individual patient's response. So the objective is twofold. First of all, to conserve existing energy reserves that you have, And the second is to prevent energy loss. So, as I said, this is achieved by using the 3 Ps: pace, plan, and prioritise, to avoid post-exertional symptoms, fatigue, malaise symptoms, general symptoms, to prevent overdoing it. Overdoing it leads to basically boom and bust, crash and burn. Overdoing it, booming one day, leads to exhaustion, wipeout, busting, the next day. So PEM, PESE, post-exertional malaise, post-exertional symptom exacerbation, may occur immediately or delayed after a few hours or even the next day. It can last a day, it can last 2, it can last a few weeks. As just an aside, post-exertional symptom exacerbation or post-exertional malaise, this is specific to long COVID and other post-viral conditions such as Epstein-Barr virus, having had glandular fever. It can just be basically lead to this post-exertional malaise. More importantly, and the reason I'm saying this is that post-exertional malaise does not happen in patients who have anxiety and depression. This is really important because this is extra supportive evidence that long COVID and ME/CFS, for that count, is not all in the head. Likewise, another fallacy is that long COVID, and the critics say this, don't they? Long COVID is just muscle deconditioning. When you're unfit, and you sit around and you're unwell, you become deconditioned, and that's the reason behind fatigue. That is not so, because when you get unfit and you go to the gym, the muscles ache the next day, but it goes off, doesn't it? That muscle ache wears off. Next time you go to the gym, those muscles ache again, but less so, and you recover quicker, and you basically rebuild your fitness and you become conditioned again. Okay, the very opposite happens with long COVID. If you overdo it, that leads to further sort of fatigue, and then you eventually do recover from that. Next time you do some exertion, then you are back to square one, and it takes just as long, maybe longer, to get better again for the fatigue to wear off. So basically what I'm saying is long COVID is certainly not deconditioning. No, long COVID is not all in the head, and it's not just deconditioning. And our critics need to hear that. And so, leading on from that, my little crusade there, how can we help with the fatigue? How else? How can we avoid post-exertional malaise, post-exertional symptom exacerbation, pacing? What is pacing? Basically, it's the process of balancing activity, that's physical activity or mental activity or emotional activity even. It's not just physical. With rest, balancing the activity with rest. The process of pacing, it's all about gaining awareness of your limitations, knowing your limitations. By knowing your limitations, you can plan how you use your energy most efficiently and most effectively. And more importantly, not to use it all up. You've got to liken your energy management to your mobile phone. As the battery drops in your mobile, basically battery power drops as we use our mobiles, don't they? But after a brief recharge, it's back to 100% full battery capacity. But if you don't recharge it, if you don't stop and recharge it, the power will drop to 0, won't it? and the power and the phone will shut down. And then it takes much longer to get back up to 100%. So use that analogy. Think about the battery in your mobile as the battery in your muscle cells. So pacing, it's all about knowing your limits, staying within those limits. And, you must say no to pushing on through. You best basically say yes to rest and recharge. So that's the first P, pacing. The second P, planning. Planning means structuring your day. Your get up time, get an alarm clock, your bedtime. Be strict with yourself. Go to bed at a set time. Build rest times into your day, in the morning and in the afternoon. Doesn't have to be long, but it's good to have a rest mid-morning, mid-afternoon. You've got to be strict with yourself. No more push on through. You've got to take time out. Also planning, plan how you tackle problems. Break tasks down into smaller chunks, bite-sized chunks. Be strict. Self-discipline. Be bossy with yourself. Resist the temptation to complete a task. No. Take it up to a certain point and then say, stop, wait, chill, relax, time out. Basically, if you're vacuuming the house, don't vacuum the whole house. Vacuum half the house. Stop, rest, 10 minutes, time out, maybe 15 minutes, time out, then resume or do the second half the next day. Planning, that's the second P, planning. The third P, prioritize. Okay. Question, prioritize. Question, what needs to be done and what can wait? Okay, you've got to prioritize. Separate the two. What can you forget about altogether? More importantly, what doesn't need to be done? Then, prioritize the order in which you do things. Important things first, less important things second. Or get someone else to do it, or even discard, bin them. Don't, bin them all together. Prioritization. So, there it is, the 3 Ps. The most important take-home message, really, of this whole talk is the 3 Ps. This is what's going to help you your fatigue, more than anything else. More than pills, more than supplements, more than gadgets, more than miracle cures or snake oil from self-declared non-professional experts on the web. And time, that's the other V. Time to recover. Recovery will not happen overnight. And acceptance, these negatives, anger, resentment, frustration at having long COVID, will only lead to breaking the 3 Ps strategy, which will lead to setbacks. Not good. That in turn will prolong the path to recovery. And chasing the dark web, the wacky spider web. No, be wary, like I said, those miracle cures. Watch out. Time and acceptance, is needed above all. Yes, I realise, easy for me to say, but I do understand. So difficult to live with, I know. So those are the sort of, if you like, the specific ways we're going to sort of focus on long COVID fatigue. But I think that it's equally important to have a sort of general overview picture on how to manage your long COVID fatigue or your long COVID overall. So what else can we do to recover from long COVID? I truly believe it's so important to take the overview, the holistic view. We need to think about sort of the mind and body, the general view, the integrative, integrative medicine, integrated medicine is, the buzzword now. Holistic medicine used to be the word, but the overview picture. So we've got to think about other things to do with us, our bodies, such as nutrition, such as sleep, such as mind, body. So nutrition, diet, a mixed balanced diet, a Mediterranean diet, so important. A mixed balanced diet will give you all the minerals and sort of vitamins and polyphenols, those antioxidants that you need. That rather than taking multivitamins, multiminerals, supplements, a mixed balanced diet will give you all those things naturally in the way that nature intended, in the most sort of bioavailable form. So a mixed balanced diet, Mediterranean diet. A mixed balanced diet provides prebiotic fibre, fibre which is prebiotic for your microbiota. I talked about the microbiota earlier, the friendly bacteria, how important it is for supporting the immune system, for production of chemicals, for production of hormones, for production of vitamins. Also important to have a healthy gut flora. Feed that flora with a prebiotic, with prebiotic fibres. Okay, so the so vegetables from the leek family, from the onion family, so bananas for the tryptophan, and fruit, just general fruit of all colours of the rainbow, as they call it. So prebiotic fibre, so important. Other aspects nutritionally, omega-3, sort of the fatty fish, eat your salmon, your mackerel, your sardines. I do myself take an omega-3 capsule, 1,000 milligrams of an omega-3 that contains EPA and DHA. Because, yes, I eat a lot of fish, but, there's no harm in topping it up. Omega-3 is very good for immune support. It's also cardioprotective, and it's also good for joints. And then finally, I mentioned vitamin D, good old vitamin D. I mentioned that earlier. No talk is complete without a mention of vitamin D. Yes, it has so many functions throughout the body, one of which is supporting the immune system, which obviously in our long COVID scenario is so important because of all the, like I said in the first part of this talk, the immune system and the excessive inflammatory processes. To have an efficiently working immune system is so important to help recovery. So that's diet, that's nutrition. I talked about sleep also, didn't I? That's really important. As we all know, sleep is the great healer. Refresh and repair. We must support the day-night cycle, the circadian rhythm, because that determines release of various restorative hormones. So growth hormone is mostly released at night. That is the cell and tissue restorer. Cortisol is released in the early hours of the morning. Helps us get up and go. These two aren't dictated to by the circadian rhythm. So healthy sleep is very important. So we've got to pay attention to sleep hygiene. So strict bedtime, talked about that in the structure bit. If you can't get to sleep, get yourself, a sleep-enhancing novel, a Jane Austen, or to help you get back to sleep if you've woken up early. No mobiles or screens. They have blue light an hour before going to bed. Blue light is more of an arousal wavelength compared with pink or orange or red light. It's all to do with the wavelengths. You can trial Piriton, or you can get the supplement magnesium, 500 milligrams. Melatonin, a lot of patients buy this online, 3 milligrams, rapid access, or circadian, the delayed onset. You can get these online. Basically, I think it's important also, having talked about diet and nutrition and sleep, I think it's important to think about the mind-body side of things. We've got to tackle worries, turbo brain, anxieties. All these lead to fight and flight, adrenaline, sympathetic overdrive. That fuels breathlessness, breathing pattern disorder. Need to address these. So we should seriously consider sort of mind-body techniques such as meditation or mindfulness. Everyone's doing mindfulness these days. I did mindfulness during first lockdown for 3 months. It was a free course provided by the College of Medicine. It was superb, and it's sort of empowered me. You could get the Headspace or the Calm app, both relatively cheap, and download them onto your phone. And they're really excellent at guiding you on mindfulness. But mindfulness is supported by many studies to demonstrate that it reduces stress, reduces anxiety, reduces blood pressure. So, consider mindfulness very seriously. I couldn't recommend it more. And other mind-body practices such as yoga, tai chi, qigong. These are, again, backed up by loads of studies for stress reduction, anxiety reduction. They're excellent because they sort of incorporate focus and breath work and coordination and general body conditioning, remembering that a lot of our patients have balance problems. So that's sort of, if you like, that holistic mind-body sort of integrative medicine approaches to general recovery from long COVID. Certainly worth considering as part and parcel of the full package, if you like, on how to get better from long COVID. There are a number of trusted resources for long COVID recovery. The Royal College of Occupational Therapists, they've got an excellent link, and I'll put a link down below, on how to manage post-viral fatigue. Your COVID Recovery, the NHS England website, so it's sort of a self-help patient resource for symptoms, information and self-management. Again, I'll put the link down below. So there we are. Those are the sort of specific and general approaches that I think will really help all patients with long COVID fatigue. The final section really is recovery. What's the time course? What are the outcomes? What can we expect? Hopefully all that I've said will help your long COVID recovery. But at this point, a lot of patients, again, have been asking me, a number of questions. How long will it take to get better? And what does the recovery look like for me? What's the final outcome going to be? So first of all, how long will it take? Well, it's impossible to predict the time course. When I started working in long COVID services, basically we were saying, because this is what was being said, that, long COVID will last sort of 9-12 months, and then, then you'll be back to normal. But hold on, it's now 3 years and we're still having patients who got hit with it in the first wave. And so, as I said, it's impossible to predict a time course. We just don't know, don't have a crystal ball. The other question, the extent of recovery. This is the tricky one. and the painful one. Well, our aspiration, our hope is that the recovery will be full, but it might not be. It might be partial. It may well be relapsing, remitting. Like we see with glandular fever, it comes and goes, doesn't it? And it can come and go years later. Again, this is basically the extent of recovery. It's unpredictable. It'll be different with everyone. But what we do know, and I think what we've got to hold on to, is that improvement in fatigue and long COVID in general will occur alongside the natural recovery from long COVID. For this to happen, there has to be rebalancing of the body's systems. So the inflammatory system will dampen down, the immune system will restore, the endocrine system and the nerve systems, these will all rebalance out and re-equilibrate. We call this a sort of homeostasis. This rebalancing will all occur naturally with natural tissue repair. Cells will be replaced. Tissues will repair. Cells will be repaired, replaced. And there's nerve fibre repair. There's nerve fibres regrow. We know about neuroplasticity. Those areas in the brain will reconnect, if you like. So the areas that have been affected, the hippocampus and the limbic system, where memory has been affected. Those patients with brain fog, when they say that their short-term memory has been affected, that will rewire, restore themselves. The prefrontal cortex in the brain also, where executive function happens, decision making, etc. Rewiring will happen there. Thinking blood clots, the micro blood clots that that occur because the blood in the COVID process is sticky, form these micro blood clots here, there, and everywhere. Those blood clots, those blood vessels that were blocked, will sort of, if you like, like we call it recanalization. So those blood clots will sooner or later dissolve. It'll take a long time, but also new blood vessels surrounding the blood clot, the vessel that's been clotted off, will be created. So we call this neovascularization. So but it takes time for those blood clots to dissolve, for the new blood vessels to form, but eventually they will. And so the blood supply to the area that's been starved of blood will be restored. So, I think the take-home message is it all takes time for these natural healing processes to work. But along with that, the time thing, we need acceptance. We've got to accept that it's happened. We've got to accept that you've got long COVID. We've got to accept the time frame, that it's uncertain. We've got to accept that the outcome is uncertain. Acceptance is important. We've got to accept it, not to fight it, not sort of to give in to it, and to give it time. So there we are. That concludes the second part of my talk on fatigue and long COVID, following on from the first part earlier. I hope you found them both really helpful. As I mentioned at the start, the disclaimer, any advice, diagnoses, treatments that I mention should only be considered after discussion with your own GP or qualified health professional, health provider. So, in the meantime, I wish you well, and hopefully you found this talk of some help. All the best to you.